Hello, my name is Josie Ann, and I will be doing my new drug report on Fycompa. Fycompa is an anticonvulsant. Its generic name is perampanel. Fycompa treats partial onset seizures with or without secondarily generalized seizures in epilepsy patients. Fycompa is the first and only selective non-competitive AMPA receptor antagonist. The AMPA receptors are located on postsynaptic neurons, and when they are activated by glutamate, an excitatory neurotransmitter in the central nervous system. When there are excess glutamates in the central nervous system, this tends to overstimulate the AMPA receptors and it causes seizures. Fycompa decreases the excessive excitatory neurotransmission by binding to a binding site on the AMPA receptor. So Fycompa binds to a binding site on the AMPA receptor, but it does not bind to the glutamate receptors. It binds to a different binding site. So therefore, glutamate can still bind to its own receptor site, but its action is inhibited by Fycompa. Due to its non-competitive property, Fycompa is effective in the presence of excessive glutamate. And this is one of the key characteristics that makes Fycompa so effective in treating severe seizures. Competitive AMPA receptor antagonists are displaced from glutamate binding sites due to excessive glutamate transmitters, making them ineffective. So compared to Fycompa, other drugs for seizure medications, Fycompa is non-competitive AMPA receptor antagonist, and other drugs are competitive AMPA receptor antagonists. And this is ineffective in severe seizures, just as I said before, because when there is excess glutamate in the CNS, they often displace the medication in the CNS from the binding site. So therefore, its activation is not blocked. Below here, you will see a link. There's a link right over here, and this link it has an animation of the mechanism of action of Fycompa, and it's a really good animation. So I encourage you guys to click on it and to watch the videos. It's not too long. The half-life of Fycompa is 105 hours. It takes 2 to 3 weeks for the drug to reach its therapeutic level. It is 90 to 96% bound to plasma proteins, such as albumin and alpha-1 acid glycoprotein. Fycompa is metabolized through oxidation by the CYP3A4 and CYP3A5 enzymes. So one can imagine the amount of drug interactions that will happen with Fycompa because it is metabolized by the CYP3A4 enzyme. And Fycompa decreases the AUC of CYP3A substrates, and it is an inducer of the cytochrome P450. So when given with other drugs like rifampin, Fycompa blood concentration levels decreases. The cytochrome P450 inhibitors increase the AUC and half-life of Fycompa. Alright, so the drug interactions with Fycompa are that occur with Fycompa are carbamazepine, valproic acid, phenytoin, lamotrigine, and clobazam. There are no known food interactions as of this time. Adverse effects. So the adverse effects are dizziness, somnolence, headache, fatigue, irritability, nausea, ataxia, vertigo, blurred vision, diplopia, cough, weight gain, and anxiety, dysarthria, hypoesthesia, constipation, aggression, anger. And aggression and anger are like key adverse effects that you really have to look for in patients. If you said they're having mood swings, that's one thing that you should encourage them to report to their primary care provider. Other effects are myalgia, hyponatremia, contusions, euphoric mood, confusion, peripheral edema, and abnormal coordination. And due to the abnormal coordination, especially when you're dealing with an elderly patient, you need to evaluate like their skin or check if they have any bruising or if they're hurting anywhere because due to falls due to abnormal coordination. Okay. Okay. So the nursing implications with FYCOMPA would be the increased risk for central nervous system depression if co-administered with CNS depressant or alcohol. So you would advise your patients not to drink alcohol, and you would also check to see if they're on any CNS depressants, and be aware of the effects that it will have on the central nervous system. FYCOMPA is a pregnancy category C. You would evaluate for allergies to perampanel or liver disease, and if so, then this will be a contraindication for taking the medication. Evaluate the patient for history of depression or mental illness and history of alcohol addiction. As I said before, it's important to know if a patient is having mood swings and if they're aggressive or angry, and the history of depression or mental illness. If they have that history, then they're at an increased risk for the adverse effects of the mood swings. And for the history of alcohol addiction, because alcohol will cause CNS depression. All right. Also, you would inform your patients not to stop taking FYCOMPA when pregnant and to contact their doctor if they become pregnant. All right. It's important to educate women, especially those in their 20s and 30s, about the decreased effectiveness that FYCOMPA has on some birth control pills. So you would just let them know, educate them about it, and give them different options for birth control, such as non-hormonal birth controls, like diaphragm or condoms. You'll also teach your patient to, inform their healthcare provider if they are breastfeeding. As of right now, the effects that FYCOMPA has on infants are unknown. So, yes. Monitor the elderly patients for increased risk for falls and injuries due to falls, due to the loss of coordination from FYCOMPA. All right. Also, nursing implications would be teach the patient to take FYCOMPA once around bedtime. The starting dosage is around 2 to 4 milligrams, and it may be increased 2 milligrams up to every day for up to a week until the patient reaches their therapeutic level. A maintenance dose is around 4 to 12 milligrams, and the maximum dosage is 12 milligrams. If the patient misses a dose, tell them that they need to take the missed dose as soon as they remember, unless it's almost time for the next dose. Advise patients to not drink alcohol while taking FYCOMPA. FYCOMPA can be taken with or without food. And advise the patients not to operate heavy machinery or drive when starting FYCOMPA until they know how the drug will affect them. To monitor the effectiveness of the drug, you'll monitor for a decrease in seizure frequency in patients after 3 weeks. You would obtain ASL and ALT for hepatic damage and blood and creatinine for renal damage. Watch for behavioral changes in patients. Like I said before, this is one of the key features in the adverse effects for FYCOMPA. So you would tell their family to report any mood swings or changes in mood to the healthcare provider. Clinical trials. So those are randomized, double-blind, placebo-controlled, multi-center trials, which included 1,000 and 3,700 people. The treatment period was 19 weeks with a 6-week titration period and 13-week maintenance. The participants had baseline seizures of about 9 to 14 seizures for 28 days. There was a significant decrease in the amount of seizures at doses of 4 to 12 milligrams. The percentage of patients with 40 to 60% decrease in seizures were 13%, 17%, and 19% for 4, 8, and 12 milligrams, respectively. Those with 50% or greater reduction were 19%, 28%, and 35% for 4, 8, and 12 milligrams, respectively. More studies are being conducted and followed to determine the long-term effects of FYCOMPA. So it's good to, as a healthcare provider, to tell the patient if there are any symptoms or anything unusual in their health that started appearing when they started using FYCOMPA, to report to the doctors due to the unknown long-term effects of FYCOMPA. FYCOMPA is a great advancement in the treatment of severe seizures. So, if you guys, I think this is the end of here's my reference. That's it. So if you guys have any questions, you can let me know. I hope you guys enjoyed the presentation and learned something from it.